Hey folks, welcome to something totally new for us. And so today you get to basically play Stump the Doctor. And this should be a lot of fun. We love having all kinds of things just lobbed at us. It's because what we do. When you practice functional medicine, you're supposed to be an expert on all biological systems and how it integrates. So as part of certification of functional medicine, you basically write the equivalent of all the medical boards over a period of 5 years. So then you have to be able to integrate that. And so yes, we can be stumped, but when we are stumped, we get back to you later, after we consult Dr. Google and other textbooks, and we'll figure it out in our research base. So with that as introduction, we have our brilliant doctors here, Dr. Kate and Dr. Stacy. I'm Dr. Den Boer, and we've been providing functional medicine here for about 27 years now, total. Cumulative knowledge, I don't know how many years that would be, but it'd be good. So I'm going to open up with just a summation of an oncology symposium I went to in Phoenix. It was about a month ago, and it was 3 days of just mental pounding, and I absolutely love that. Mostly oncologists were present, mostly medical. I was an odd duck out. But there was a total of 32 speakers, some of the most brilliant scientists, researchers in the world that headed up either large oncology clinics or were doing the research. And it was extremely rewarding to listen to them state their opinions, state their research and where they're going. And you know what? They're coming our way in a big, big way. Now, what I've seen is when research starts coming our way, it takes quite a bit of time before it dribbles down into the oncology field in a local city like Grand Rapids. This is going to take time, but it's exciting that winds of change are in the air. And also some very fascinating medical news was released. So I released some of them in tidbits with little videos on Facebook, so you're welcome to review them. Those were done while I was over there. And then this past week, I just went through all the presentations. It was good because a review is always good, and just took out a few key sentences out of there that I'd love to share with you. And thus you might be more ahead on research than the local oncologist here. I get the secret delight in educating my patients so they can stump their doctors. One of the key factors that emerged out of this symposium was just the fact that the data regarding oncology and really health in general is just rapidly accelerating. It's becoming almost overwhelming. It was stated that by the year 2020, the data will double every 3 months regarding healthcare and also oncology. So this is just an incredible explosion of knowledge that we're undergoing. And so yes, us doctors are just kind of scrambling, as you can imagine, figuring out how to keep current and making sure that we stay up to date with all this incoming data. Luckily, we have the computer as our ally and computer programs to help sift through all the information and compact it for us. Out of this, what is being birthed is precision medicine. And what precision medicine is, I read down the quote. It's a tailoring of medical treatment to the individual characteristics of the patient. And doesn't that make sense, right? Because we are all so unique, and because medicine is for real people. Statistical analysis coming out of research is not really, it's just interesting, but that's not you. So precision medicine is tailored specifically for you. However, what this researcher was presenting was no doctors out there are keeping up with the data that's coming out so that they can apply precision medicine. So it's become a real problem. And I've seen that, and it's been actually one of my pet peeves with medicine is that it seems like the name of the game is the diagnosis. Let's put you in this diagnosis box. Oh, you've got this, and therefore these are the medicines that are appropriate for that. And if you go outside that box, guess what? Insurance won't cover you. right? So it's this whole weird system that we have here that is not allowing change to occur rapidly. It's making us very rigid in our healthcare. So another important piece that came up, and this one was a very new topic, and it's this. Estrogen silences the immune system. Therefore, all kinds of cancers respond to estrogen through the microenvironment of the immune system. Whenever estrogen goes wrong, and those of you that have been here for a while, we talk extensively about estrogen and its subdivisions and its inflammatory components. That influences the immune system in male and female in a much greater fashion than we've ever known. That could be fueling colon cancer. Yes, it's effective with breast cancer. Even the non-responsive, the non-hormonal breast cancers, right? Those are called the triple negative breast cancers. So making sure that estrogen metabolism occurs in a correct way, and yes, it is measurable in male and female, is really important. Males at age 50 have more estrogen inside their bodies than females do. A very little recognized fact, but it's true. So therefore, it's an incredibly important modulator for the immune system. Another paper was presented on the microbiome. And the microbiome is the bacterial colonies that populate our gut. And I like to tease my patients often that we're barely human. We're mostly bacteria. More than 90% of our DNA is actually bacterial DNA. That makes us only 10% human. So it's a little bit like when I was little, I had those little stick figures, and you had the little strings, so you know what I mean? And I sometimes feel like we're a little bit like that, where the bacteria that are living in us and on us are really controlling us, and we're just kind of responding. So the microbiome influence on cancer is immense, and that's no surprise because the microbiome composes 70% of our immune system, and therefore I feel that, and I'm dating myself here now, but in the 60s there was this really important book that came out, called The Silence of the Spring, and it was actually the birth of the environmental movement, and it was an expose on how chemicals is killing a lot of the good things in the environment, and thus ultimately affecting us as humans. And I would think a very witty title for a book would be The Silence of the Microbiome, because over time we have had a tremendous negative impact on the microbiome through the use of antibiotics, our environment, processed foods, medications, stresses. The fact that we're now born in hospitals, which introduces bad bacteria into our gut right at birth. I can go on and on and on. So we have had a dumbing down of our microbiome, which makes us much more prone to chronic disease. And I feel it's been very much behind the incredible rise in autoimmune diseases, cancers, as well as even behavioral disorders such as autism. They're always looking for that one thing that has caused it. Guess what, folks? They're not going to find it. It's kind of a cumulative effect of the environment on us. What we eat, the stresses we expose ourselves to, the medications that we use. So this microbial influence on cancer was described, was proven, and this researchers had a very excellent done study on red meat. And it appears that red meat, when there's a certain genetic subtype of people out there that does not digest it really well, and it produces an excess of something called L-carnitine in the body. And L-carnitine happens to be very procancerous, especially for colon cancer, but other cancers as well. So for some people, red meat is a real negative. And I thought, isn't that interesting? Because I've seen so much data on red meat that, ooh, it's inflammatory, ooh, it's procancerous, and others, no, it's really good. This is more the paleo type of people. It controls your sugar levels, and if you have, especially if you have grass-fed red meat, it's good for you. Guess what? They may both be right. For some people, red meat is really very bad, and for others, they can digest it and actually utilize it. So, like most complex things, it's even more complex than we thought. So that was an interesting paper that was presented. And then another one that really cued my interest was nutraceuticals and cancer with clinical trial support. Which are the nutraceuticals that actually have a lot of research behind it? Now, mind you, this was not a paper that was done on what prevents cancer. Okay, there we have a vast amount of evidence, but treatment of cancer, there's very little well done research, because most of the money in research goes to pharmaceuticals. Does that make sense? It's just the way it is. So it doesn't mean it doesn't work, it's just we don't have that much data on it. And but the ones that came out as the top ones, as far as what we have clinically trialed in active cancers, is omega-3 fatty acids. So those are your fish oils. Dramatically reduces inflammation and thus improves outcome in cancer. Resveratrol, alpha lipoic acid, here that's known as metallipoate. That's really it really regulates sugar levels and helps the liver function. N-acetylcysteine, or NAC for short. This really rises up your capability of making glutathione, which is your main detoxification molecule. That's the detoxification molecule, and we use it here in boot camp to assist in weight loss. So that weight loss is done safely without release of too many toxins. Vitamin D, no surprise there. And vitamin D has been studied the most, actually, and it is amazing what vitamin D does for cancer prevention. I would say if I look at the whole picture, regular vitamin D supplementation through seasonal changes appears to reduce most cancers between 40 and 50% incidence-wise, just vitamin D. So that's why I'm always pushing, us doctors are pushing, are you taking vitamin D? Are you taking vitamin D? This is Michigan, yes? So, and vitamin E and selenium, and this is a big study that was done actually in Britain on over 20,000 registered nurses, and E selenium improved outcome in breast cancer very dramatically. So it was good to see that one rebirthed, because when I started practice, I saw some evidence of that even back then. Again, a lot more is on the preventative front, but that's a huge other topic. And then one of the key speakers was Sidhartha. He is a researcher from India, now teaches at Columbia University, the medical school there. He is kind of a rock star in the world of oncology. He also is a very gifted writer. If you want to read one of his books on this topic, it's called The Emperor of All Maladies. And it's a wonderfully written book. It could be literature. It's written that well. Very entertaining, and it goes through the history of cancer, the research, and where it's all going at this point. It's very up to date. It's about a year and a half old. He just came out with another bestseller, New York Times bestseller, and it's called Genes, The Gene. And it goes through the discovery of genetics, and then it goes into genetic expression. It's also a very excellent book. But he made this phenomenal little discovery, which is so elementary and so basic. And he was able to demonstrate a 40% improved outcome in breast cancer, kidney cancer, and colon cancer. And it was very, very simple. In the world of cancer, we know that P13 kinase, which is an end result of glucose metabolism, fuels cancer. So we've been doing tremendous amount of drug research on how to block this. And he had the realization a few years ago, how about if we just try to control sugar, and thus we get rid of that? Yeah. So because it's a very simple pathway, very elementary. It gets taught in high school. Yeah. This is a very simple pathway. So he started experimenting with a ketogenic diet. And the ketogenic, we have a healthy version of ketogenic diet here called Nourish that we teach in health coaching, and have used that for quite a while to reduce inflammation, including cancers. And basically, it puts you in a mild state of ketosis, which is a more preferable fuel form that professional athletes use also, because it improves performance. It's less inflammatory, and you're just making sure that PI3 kinase goes down, which then reduces inflammation and reduces cancer issues. It improves outcome, like I said, by over 40%. Colon cancer, he was able to quote 42% improved outcome with traditional therapy. And so just teaching the patient to eat different, 42% outcome. I'm looking at some of the other presentations that I'm not going to bore you with different drug combinations and this and that, and they were celebrating a 2 or 3 or 4% improved outcome. That's what they're going on. And they were celebrating that. And I'm going, to me, that's not nearly good enough, right? So this was a very major tool. He did the research on it, was able to demonstrate this, and then Dr. Jeffrey Bland, who is an absolutely brilliant researcher as well, my mentor, he came up on stage to kind of sum up some of the research, to translate it for mere mortals like myself. And he stated, well, we did that research as an observational study back in the mid-1980s, and he quoted the study. So it apparently wasn't new at all, but for him it was. And it's funny to see the research just come around. It seems like we have to keep reproving things. So that was the oncology symposium. And so I would say more than half of the presentations was on lifestyle, diet, modifiable things, nutraceuticals, and the other part was more genetic testing, precision medicine type of thing. So it was very enjoyable, and it allows us to stay current and keep on providing cutting-edge therapy for our patients, because oncology is becoming more of an issue that we see here at DBC. So wrapping that up, what we're going to jump to now is question answer. And this is not about answering individual case studies where, well, I had this and then this and this and this. It's not meant as that. These are questions that have always intrigued you. If we don't get to a certain question, then we will definitely consider putting that on Facebook, where one of us doctors will give you a video answer or a blog answer to these questions. We're going to keep sorting through it. We're going to do our very best to pile through as many as we can and keep it interesting. If you want to review this is going to be on YouTube, and I think we'll have a fun time with this one. So, would you like to start? Or was there something else to add?
There are several regarding cancer, and I didn't know if maybe you wanted to just tackle those, since
Absolutely.
some of them are more redundant to what we're talking about. This one too, can you read that?
Okay.
So maybe you already mentioned a few, but...
Yeah, here's a hot potato one. When taking chemo treatment, to what supplements are okay and why? Or what supplements are good? Now, there's Grand Rapids is, as you know, a fairly conservative community, right? And that has its strong points, but also can be somewhat negative in some instances, like cutting edge treatment, because change comes a little slower on some fronts. A lot of oncologists in our beautiful community are somewhat or virulently opposed to nutritional supplementation while undergoing treatment. And that is on the erroneous fact that the belief is that these antioxidants will work against the chemo and against the radiation. Nothing could be further from the truth. The side effects can be greatly minimized. The immune system can be preserved, and the effectiveness of the chemo or radiation can be stepped up just by the nutraceuticals. And this is a really important fact, and this has been proven with outcome. Just on probiotic studies alone, where we're taking care of the gut, which then takes care of the immune system, outcome improvement in specific cancers, it's amazing the difference. So what we try to do is tread the line where we're supporting the patient, because the patient is number one. At the same time, not having them cut off their relationship with oncologists, because obviously that's very negative as well. So we try to do as much as we can with food, because who can argue with food, right? And then try to apply nutraceuticals where we feel it's absolutely essential, and don't go overboard with it, and thus support the patient in the right way. Because really we want the patient to have confidence in an oncologist. We want them to not destroy a good relationship, because that's part of therapy, isn't it? And thus delicately weave our way through that. Occasionally we have a patient come in that says that is not in the traditional medical field, and then of course it's we unleash the full power of nutraceuticals as we know it, and then that becomes a little bit of a different game. So
Did you say what those were?
no, it varies quite dramatically from patient to patient. So probiotics, making sure vitamin D is level, some vitamin C, so antioxidants, is basically a hallmark. We usually give something called NK Stim to stimulate natural killer cells, because they're very anti-tumor. Empower, same thing. These are mushrooms that are designed to stimulate that part of the immune system that that stimulates NK cells or natural killer cells. So those are kind of common ones, but different kinds of cancers, different kind of protocols. The one thing that was emphasized at this oncology symposium was really the fact that the one cancer is so unique to each individual. So prostate cancer, even though the diagnosis is identical, can vary incredibly in size, morphology, genetic mutations from one person to another. So it was really urged that in order to really treat the cancer properly, each one should be totally uniquely treated, analyzed, and that genetic analysis of the tumor should then be thrown into the data bank, which is nationwide, where we have thousands, tens of thousands of case studies like this, as well as response to certain chemo and lifestyle changes. So this data bank is expanding very quickly, and so this individualization is really important. It hasn't really come to Grand Rapids yet.
But like you said too, I think any time that we can limit or modify inflammation, that whole cascade, right? Anything that we can do, whether that's with food. We had a question here about gluten-free and colon cancer. Gluten tends to be quite inflammatory to most of us, if not all of us. I think we would argue strongly that, especially with people who are predisposed to gut-related issues, colon-related issues, that staying away from certain inflammatory foods or components to foods like gluten just sets the baseline, right? Anything that we can do to lower inflammation, even if we're not specifically targeting a type of cancer, helps with outcomes, which is the same thing he was talking about with sugar, right? With that metabolic pathway. Anything we can do to lower that. Same thing with turmeric, right? One of the main anti-inflammatories that we use in our big gun anti-inflammatory Ultra-Inflamex has a derivative of turmeric in that is super effective with reducing inflammation. So anytime that we can do that with any patient, but specifically with a cancer patient or a patient who's undergoing inflammatory treatments like chemo, radiation, that's where we seem to get our biggest general bang for our buck.
Well, and you're always trying to increase nutrition because you're already depleted in your cells, so they're already stressed, so you're trying to get as much of a nutritional load in as possible with food and supplementation if you have to.
Yeah, it's the view that was emerging out of the oncology seminar was in a lot of cases, not all, but in a lot of cases, cancer really is a multi-system disease. So even if we're focusing on, say, just a prostate or breast cancer or what have you, it really is a breakdown of multiple systems, and usually it's due to some sort of malnourishment or toxic assault. And so re-nourishing the patient is absolutely critical.
Absolutely.
Yeah.
You spoke a little bit about hormones.
Yes.
A patient asked, eliminating soy really affected my wife's hormones. If soy can affect women's hormones so much, should men eat soy? We were talking a little bit about estrogen, right? He had heard it can affect testosterone. You want to address that one or talk a little bit about
it can affect testosterone in a positive way. I don't know if the question is soy negative, but soy is negative in that genetically modified soy is a very negative thing. It's 10 times as allergenic. It is very inflammatory. It's hard to break down, and was made illegal only 1 year after introduction into Europe because of the incredible rise in emergency room visits. They keep their statistics there, and the lobby groups aren't as powerful there, so that kind of soy is no longer legal. So if you eat soy, it's got to be non-GMO or organic. Organic is non-GMO. And that makes up for a totally different experience for the body. It is anti-inflammatory, and it regulates estrogen, because what it does, it affects very positively the estrogen-like receptor, or it's called ELR, not the estrogen receptor. And there's one researcher that made a huge mistake and called soy estrogenic, and that is so far from the truth. It is not estrogenic, but it's stuck. Everybody calls it that. It's estrogen normalizing. Okay, so if you have too much, it'll bring it down to normal. If you have too little, it'll bring it up. A big meta-analysis of organic soy was done by Harvard Medical School on breast cancer survival rate, and those that were allowed soy had a 23% improved breast cancer survival rate. 23% is a lot.
Which is
And-
why in the last 3 years, they okayed soy for breast cancer patients.
Yeah.
Yes. So, does that answer that? Yeah.
I mean, yeah, so yes, men should eat soy.
Definitely.
It's a great source of protein. Can be very nice and clean. And a lot of men do also require, like Dr. Den Boer said, later in life when estrogen gets high, to modulate that estrogen, even within, we just don't talk about it for men. So pretty important.
It's the most studied phytoestrogen, which is food-based estrogens that come out. Broccoli and Brussels sprouts are also what would count as a phytoestrogen. They just don't have as strong of an effect as soy would on testosterone. And mostly what happens with men is the reason why it works is it works against the DHT, which is your inflammatory testosterone, which ultimately ends up as estrogen. So it'll help to balance that and bring you back into the testosterone balance that you're looking for.
And an added carrot, if you do this, you will build muscle more quickly.
What's the best form to get that natural soy in? The non-GMO soy?
Food.
Just what, like,
Edamame.
Non-GMO, yeah.
Edamame.
Edamame is great.
Edamame, especially fermented forms of soy, so miso, natto, tempeh, soy sauce, those are all really
Health coach to the rescue here. Thank you. And there's also the good soy milks, right? Yeah.
Definitely want to make sure that you have the organic and
Yes.
unsweetened.
Unsweetened is huge.
Yeah.
Oh, yeah. Gotta undo it otherwise.
Let's just add the sugar.
Do you want to take one of those, Dr. Stacy?
Sure, I have one from YouTube that I figured I'd touch base on. It says, what effect does B12 deficiency have on your mental health? B12 deficiency is probably one of the most studied B vitamins with mental health. What you're looking at is it's a 1 carbon based reaction, and what it does is it actually helps with myelin sheath, which is what covers your nerves, so it helps with transmission of the nerves. So it's very, very important. It also has a requirement within all of your neurotransmitters that B12 does support those neurotransmitters. So it helps keep serotonin working, GABA, acetylcholine, dopamine. But B12 has been studied a lot in the over 60 population with dementia and Alzheimer's being deficient as one of the causes. So it's very important for your mental health. There are different forms of B12 that are available. There's usually a methylcobalamin and a cyanocobalamin. The methylated cobalamin is what you're mainly looking for because it's the most active form of B12. And traditionally, you don't want to take B12 by itself because it marries well with folic acid, which should also be in the methylated form. Anything else to add?
Well, back in the 1950s already, it was published by Dr. Abram Hoffer, who was practicing in Alberta, Canada, that he had an incredible success rate in schizophrenia. His success rate was close to 70% in 6 weeks as far as curing schizophrenia. And he did that with massive doses of B12 and folic acid. And the massive doses was 10,000 to 100,000 times the RDA. And so this is very intriguing. It was well documented. And I'm seeing it somewhat being referred to again. So I'm happy to see that coming back.
Difficult to absorb, right?
Difficult to absorb. And that's why we use intrinsic factor with it. The product we use is called intrinsic B12 folate or vessel care, and it's got the intrinsic factor with it that improves absorption dramatically. Most of the time, when you take a B12 just on its own, you're only absorbing 3% of it. Sublingual, you're absorbing at the max 6%. When you take it with intrinsic factor, you're absorbing 70%. So that's almost as good as shots. And we've had patients who used to give themselves shots, B12 shots, transition over to this vitamin very successfully without any hiccups. Yeah.
And that's about 400% of your RDA is what's on the label there.
Do you want to talk a little more about Alzheimer's dementia since we had another question
yeah, we had
about
another
that?
question that says, and I'm not sure if anybody knows if that's else. I'm sure anything else for memory loss or Alzheimer's or prevention or health, I think is what I got here. Well, Alzheimer's is really a tough disease because as you're looking at it, you're looking at loss of more of neurotransmitters within the brain and ability to cognitively focus and memory and those kind of things. So B12 is definitely a piece. that goes on there. This is really a nutrient deficient that has to continue to work with. Most patients don't think about Alzheimer's early enough in life. We're all not really worried about it when we're younger, let's be honest. So we don't think about continually taking our vitamin D and our vitamin Bs and, you know, calcium and other things. So this really comes down to more of a balanced diet, because if you have a lot of inflammatory cytokines from, say, high blood sugar that are consistently happening, then basically you're going to stress the brain out and the neurotransmitters are going to be weakened. What we have found that the neurotransmitters respond a lot to what happens in the digestive tract. So a happy gut, happy brain. In Europe, they believe the brain or the gut is the second brain. So you really are working all the time on trying to keep a good balanced digestive tract. The microbiome is really a big piece here. But really it comes down to a lot of essential fatty acids. So your good fish oil fats, making sure the fish oil that you're taking is also tested for mercury, arsenic, and lead. They do a lot of testing for mercury, but not as much for arsenic or lead in your fish oils. And then really ultimately just making sure that we're following a good balanced diet. Colors are really the key here when you're dealing with anybody with dementia and any type of Alzheimer's patients. Is you're trying to get a rainbow of food colors in every day, which I know is very tough, but that's what we're shooting for.
Well, and some researchers are calling Alzheimer's diabetes type 3. So that's how much blood sugar has to do with Alzheimer's dementia, because Alzheimer's is really a diagnosis after the fact, looking for those neurofibrillary tangles on autopsy. Alzheimer's can look so different, progress so differently, and so the cause of the etiology may be different as well, even though we're grouping everyone into the same. It's like with cancer. We were talking about breast cancer is not breast cancer. There are 100 different kinds of breast cancer that need to be treated differently, but they are finding with Alzheimer's that blood sugar does underlie a lot of those issues. So in America, right? I mean, blood sugar seems to be a big problem or a big underlier for a lot of the chronic conditions, or the degenerative, maybe is a better word, conditions that we see, especially in this country, that aren't happening in other places in the world.
What's frustrating to see out there is we're always looking for the cure of Alzheimer's, and that the cause is unknown. Well, they're dead wrong. We know the cause. It is sugar dysregulation or heavy metals or something going on in the gut, just inflaming, attacking the brain. And if we can successfully address those, Alzheimer's can be reversed. We've seen it in our office, and last year, actually it was the beginning of this year, they published a big study that shows that with Alzheimer patients, when you measure all the inflammatory markers that we know of, 32 in this case, and you can reverse through lifestyle half of those, so 16 of those, which is, I'd say, a rather incomplete approach. But if you could reverse 16 of those inflammatory markers, you are reversing Alzheimer's. So that's big. But it takes a dedicated patient and a dedicated doctor to do that.
And the problem is catching it early enough.
Yeah.
There is a point of no return. Yes.
Do you want to talk a little more about blood sugar? Since we
Cure for diabetes.
question
You know, diabetes, it depends what kind of diabetes it is, of course. When there's what's called type 1 and type 2, now of course type 3. And if with type 1, where you have an autoimmune disease attacking the pancreas and destroying the pancreas, well, you don't have a pancreas anymore. And it's gone beyond the point of no return. And for those people, modern medicine to the rescue, right? Insulin has saved so many lives. Did you know that before insulin came along, we did it with coffee? Before insulin came along, we would encourage patients to drink about 15 cups of coffee a day. And that could somewhat regulate sugar levels. History of medicine is very fascinating. But what's coming around the corner as far as a cure is smart technology, where we have an artificial pancreas, where it's like an insulin pump, but it's a much smarter insulin pump, where every 2 minutes your sugar levels is leveled, is measured, and we can do that now through different patches. So we're coming up with different ways of doing it, in the ear, on the eye, mucous membranes, and they're starting to measure it through skin, although skin, we're having a problem with sweat. So we're getting a continuous readout of sugar levels, and this pump will then just secrete the appropriate amount of insulin as is needed. So I'm really fascinated by that technology. The cure for diabetes is really in type 2. Oh, and by the way, we've seen where a patient was just in the beginning phase of being destroyed by this autoimmune disease, and those people we were able to rescue, because if you stop the autoimmune disease right in its tracks, the pancreas will come back yet at that point. Type 2, this is a different one. This is lifestyle associated, isn't it? And we always associate that with obesity and all that. You know, that's not necessarily true. The tall, skinny, thin, as a real patient can also come in with exactly the same problem. Fools everyone. Type 2 diabetes. And what is type 2 diabetes? It's basically a result from something called insulin resistance, where the body's become resistant to the action of insulin because of too much abuse of carbs, sugars, and the insulin's had to rise too many times to the occasion, and eventually the body just turns a deaf ear to it. I'm not going to listen to you anymore. That's it. So then the body has to keep revving up insulin in order to try to control the sugar, and eventually it runs out of steam. The body's not responding to it anymore. It can't produce that amount of insulin anymore, and you basically have wild sugar at that point. So the trouble is, doctors are just measuring sugar levels. Nope, your sugar is fine, while they are right at the brink of type 2 diabetes, because type 2 diabetes is often measurable 5 to 10 years before it happens. So we should be using other markers, such as symptoms of the patient and fasting insulin levels. And the fasting insulin levels, unfortunately in our country, the norms are ridiculous. I think they allow up to 30 units or something like that. In Canada, it's 12. And in Europe, anything over 8 is considered pre-diabetic. Triglycerides on your cholesterol panel is also the indicator, because when insulin goes up, often triglycerides go up with it. So that's another indicator that you may be having problems. But another indicator is, of course, abdominal fat in some people. So lifestyle modification, we do that with health coaching, where we teach a program called Nourish, which is for sugar regulation, decreasing inflammation. Boot camp sounds scary. It's not, I think, but that's my opinion. So then we teach patients how they should eat, and it's remarkable how reversible type 2 diabetes is. Bit of a long-winded answer, but it's a really important topic because it's really afflicting the nation. 1/3 of our teenagers today are pre-diabetic. So this is a looming health crisis that could bankrupt the nation.
Yeah, and it's the same frustration that we have with a lot of things that we fail to treat until we get abnormal lab results. And I think that that's a big concern when we have patients come in with all of these symptoms and their doctors have told them, no, you're fine, right? Or they've told them, well, your cholesterol looks good because you're on this statin drug, so you're good. When, it's giving you a false low on some of those other things. So really paying attention is huge for that, and really being preventative early on. Even if you have normal numbers within a normal range, it's a big deal.
What's the most important, eating or exercise?
Eating, I would say, for diabetes, yes. There's a definite correlation between the two, but I would say it's hard to exercise away an insulin level that's going like this. Yeah. Would you agree with that, docs? Yeah,
eating is probably 70%, but that doesn't rule out that exercise doesn't help it. It does. I think in advanced type 2 diabetes, eating becomes more and more prominent, and whereas if you're starting to flirt with it, exercise becomes more important.
Sure.
But that never takes away the specter of bad eating, because if you continue to eat bad and start running marathons, you're still going to get diabetes.
Right. Yeah.
What about diabetic neuropathy? Is there a comeback for that?
So the question is diabetic neuropathy. Is there a comeback? And there definitely is. One is, of course, stop the assault of sugar on the nervous system. And by the way, even mildly high sugar levels, so not officially diabetic. I have a patient who I insisted, no, you have all the symptoms of diabetic neuropathy. This is diabetic neuropathy. Yet her internist would not agree with me because her sugar levels were averaging around 105, 110 at that point, which is not officially diabetes yet. But anything over 94 will cause damage. You want to regulate your sugars between 74 and 94. Anything above that will cause damage. And if it's there long enough, it could cause diabetic neuropathy. It is reversible. First, get rid of the sugar assault. And then secondly, give the body some potent nutrients such as lipoic acid and coenzyme Q10 and the B vitamins. And I've seen diabetic neuropathy reverse itself in 3 months. Not every time, but I have seen that. Yeah.
Did you have a question about sugar relating to the liver that you wanted to talk about?
Yeah,
since
there
we're
was
on
one
the
that
topic?
said, how does sugar get from the digestive system into the liver and then into the blood, which is, it's a little backwards. So basically, we're gonna do a little anatomy workup. So food goes into the mouth. We start with mastification and salivary enzymes, which helps start to break down. The esophagus is just basically a tube to get it from the mouth to the stomach. The stomach has digestive enzymes for hydrochloric acid to break down mainly your protein, calcium, and magnesium. Then it goes into the small intestine, which is where the liver enzymes, the pancreatic enzymes all go into pancreatic, or the small intestine juices in that are help to break down your protein, carbohydrates, and fats at that point. Then they get absorbed through the small intestine into the bloodstream. So your sugar can actually get into the bloodstream, and that's where he was talking. If your sugar gets too high, then you have to use your insulin levels to help to control that. And that's really where it comes down to. It actually goes from the blood then to the liver, which ultimately can then create higher amounts of cholesterol. If you have too high of blood sugar, you can just be storing into fat because the body is thinking, okay, we've got excess energy on board, let's store this for later. But very little of it usually is generated out of the body unless you can regulate it through your foods. So, okay?
I think we exhausted the blood sugar topic, did we?
Yeah.
I hope so.
We hit that one hard.
That one.
Did you have a follow-up on that?
Question. Since diabetic neuropathy can be reversed and chemotherapy-induced neuropathy,
Very much so. So can we reverse chemo neuropathies, or also brain fog, which to me is almost like a neuropathy of the brain, if you want to call it that, and it's chemo and or radiation related, and it is very treatable. It has to be treated with a methylated form of folate, so that's called 5-tetrahydrofolate. This can be utilized while undergoing chemo and radiation. It's amazing how patients come out with a lot less of those symptoms. But you can only go a certain dose with that while undergoing active medical treatment. Afterwards, to do repair damage, we use gamma-linolenic acid, GLA oil, that's another name of it, with the mixture of those B vitamins, along with coenzyme Q10, which is the engine for nerve regeneration. And it's amazing how they come back. Absolutely amazing. Yeah. Okay.
I'd like to take one regarding colon cleanses. There's a question from YouTube. What are your thoughts on colon cleansing in regards to gut bacteria was their question, but I want to talk just a little bit about that because it's extremely popular. You can type cleanse into Google and find a million different types of colon or intestinal cleanses or juice cleanses or coffee enemas or a million different things that you can find that are out there. And I have patients who are very frequently confused. What's the outcome? What are we trying to do here? What's a good cleanse? What's not a good cleanse? First thing that I always talk to my folks about is the difference between a cleanse and a detox. A lot of times those words are used interchangeably, and we don't think of them that way. A cleanse has to do with your digestive system. So when we talk about cleansing, we talk more about getting out static, either bacteria or leftover food particles, or if the bowels aren't moving the way that they should, anything that's backed up, right? That's what we're cleansing from. It doesn't really have anything to do with, or not a lot to do with, toxins in our body. Sure, we need to be cleansed in order for our body to detox, but the detoxification part comes from the liver. So when we're talking about doing a detox, we need to be sure that we're actually changing or supporting what the liver is doing. We're always detoxing. Our bodies are constantly making toxins, taking in toxins from our environment. We have to always be doing that. That's one of our liver's hugest jobs, is to detox the blood. And so if you're doing a detox, we need to make sure that A, we're modifying what the liver's doing, helping it do its job better. And B, we are also able to eliminate. So that's where a lot of the cleanse comes in, right? So we want to make sure that if we're going to do one, we should also be doing the other. So doing a juice cleanse, right, can be really nice. You're missing the detox side of things when you do that. It can be helpful for getting rid of certain extras that are hanging out in our bowels or in our colon. But at the end of the day, are we really getting rid of the toxins that we need to, right? That's why I have a lot of patients come in and say, I do all these cleanses, I've done all these different things, it doesn't seem to help me long term. That would be why, because we actually have to ramp up some of the detoxification. Now, when it comes to gut bacteria, Dr. Den Boer, I think you had a question about that too, that you were going to talk a little about. That microbiome that he was addressing earlier, cleansing or getting rid of, let's say, unwelcome guests within our microbiome, I guess. It's hard to say that a bacteria is good or bad, because a lot of times it has to do with how much there is of a certain bacteria, or how many friends it has tagging along with it. So we have to make sure that if we're talking about the microbiome, it's not enough to just make sure that our colon is emptying all the time. We actually have to address what bacteria do we have in our gut, at what levels, and that's a much more sophisticated question. I don't know if you want to take any more time to talk about
I can take it from there. I think it was a YouTube question that asked if I'm taking probiotics, why do I have to always keep taking it in order to create change? And it's important, and this is a frustrating topic, because we know probiotics improves outcome in a lot of things. Right now there's more than 500 clinical trials in probiotics in North America alone going on in the hospitals. They're seeing phenomenal results. They're finally on board with surgical outcome and outcome for treatment of diseases. And so we know we can get a great benefit from probiotics, and I recommend everybody take one. It's amazing how it can improve life. This is also why in Europe fermented foods are so popular. It creates a better environment for your gut microbiome to thrive in a sense. So probiotics, there's two different kinds of bugs. Okay, one is called a wild type, and the other one is called a domesticated type. And the wild type is our permanent residents. They do all the heavy labor for us. They are the permanent occupiers. The domesticated ones are much weaker, and they work as they go through the intestinal tract. They change the environment, they change the pH. They are part of their immune system, but they are temporary visitors. And very few of them are actually strong enough to latch onto the gut wall and become permanent residents. Some do, but not many. Your probiotics are the domesticated type. We have not yet figured out a way how to put the wild type in, and maybe thankfully so. Because as we're starting to study the microbiome more and more, we're seeing not just a few bugs, but we're seeing hundreds and thousands of different kinds of bugs. We're starting to find out that even fungi and certain viruses is actually essential to good gut development. And if we go in there and try to hijack it, then we are probably going to do more harm than good. So these domesticated probiotics, these domesticated bugs really create a good environment for the gut to self-correct as far as function goes. But a lot of us have a template from birth, which is the wrong template. Most of us are born in a hospital. 50% of you thus have abnormal bugs from the hospital. Okay, those that are born with C-section didn't get at all good chance at good bacteria. If you've had even one antibiotic the first year of life, you have irrevocably changed your template for life. See, so a lot of us have this abnormal population that we continuously have to steer in another direction. It's a little bit like a car that wants to pull this way. Yes, you can make it go straight by just doing a little counter steer, and probiotics are a little bit like that. Slightly frustrating, but it is what it is, and I think it's the cost of living in this society. So, there it is. There is one type of therapy that you can get the wild type, and that is the fecal transplants.
I have that bone broth one.
Yeah, I have a couple on thoughts on bone broth and gut healing health benefits, and what are the comparisons with what's on the market. The hard part is commercial bone broths. We don't have a lot of research on what the commercial bone broths are, where they're being made from. So, I mean, if you can't make it, sometimes it's good to buy it, especially if it's organic. You really want to make sure that it's coming from a good organic source. It's very good for healing of the gut. There's a lot of research with the collagen and the other nutrients that come in with bone broth that help to build the immune system and help to repair gut lining, which is why bone broth is kind of the new thing on the market right now. But I can't really speak to commercial made. Any ideas on either of you?
Well, it seems like anytime we put anything in a package, we ruin it. Eat plants, not things made in plants.
Is that something you could get at your farmer's market? A pre-made bone broth, you think? Not a packaged one, but
I don't know, I haven't seen it.
Yeah,
it might be interesting to check out.
not much data on this one. So a little bit inconclusive.
Bone broth is awesome, but yeah, it's certainly a sourcing issue.
Should
Like a lot of things. Sorry.
No, should
going.
people get the flu shot? No. One,
Take a poll.
it doesn't work. Number two, it can trigger an autoimmune disorder. And I've seen that overnight trigger autoimmune disorders. Number three, who'd want to put that kind of toxin into your body? And number four, we don't really quite know what it's doing to the immune system. Is it going to come back to haunt us later? I wouldn't go near it. To me, it's just one big money scam. Very interestingly, we have two microbiologists that work for one of the big pharmaceutical companies in Kalamazoo. They do the research for the flu shot. They themselves do not take the flu shot. Case closed.
Well, what do you do if you have to for your job?
That's a good question. So if you have to do this for your job, then what we do is give you a homeopathic remedy called vac cord. That allows the body to detoxify some of the stuff that's in the flu shot, helps minimize some of the side effects. We also instruct them for a few days before and a few days after to up ultra potent C. This is a fat soluble vitamin C that not only helps the immune system accommodate the salt more effectively, it's a good antioxidant, it also will bind to some of the toxins that are in the flu shot so that you can more safely eliminate it.
Really
So-
important to not get the flu shot if you are sick. You have to have a very, very highly functioning immune system. If you're feeling sick, don't get it during that time. Wait until you're feeling better.
As with any vaccine.
As with any vaccine, for sure. But that's out there. I mean, more and more jobs are requiring flu shots or of some kind. I don't know, are they still doing the one that you inhale? I'm not
Yeah.
sure.
Not this year.
They're not doing that one this
That
year?
one's not effective this year.
Okay.
Effective.
Well, that's what they said.
Yeah, that's a good one. Let's see, do you want to take the calcium? Do you want to go into that at all? How much calcium?
The
That's
calcium question. So there's so much controversy on calcium, and there's so many different calciums out there. And really, there's only one that science has proven, and even went through the court of law, to the Supreme Court of California. And that is, one company dared to make the claim that calcium hydroxyapatite can not only stop bone loss, but reverse it. And the health department there took a dim liking to that statement and say, we're taking you to court for saying something false. They were able to prove the case that they could reverse bone loss in women. And of course, courtroom dramatics, they paraded in the evidence in 2 wheelbarrows. Yeah, there was so much evidence here. The trouble with calcium is there's so many insoluble kind of calciums that the body absolutely cannot utilize. In fact, it's harmful. Might even pull calcium out of your bones. And that's the calcium carbonates and citrates and oxalates, which is 95% of the calcium is on the market. It's junk. It doesn't work. It's bad for you. Shouldn't be on the market. Calcium hydroxyapatite is derived from calf bones from New Zealand, where the environment's much cleaner, doesn't have the heavy metals in the environment, and it most closely approximates to human bone because it's not about calcium, but it's about strength, tensile strength, not just density. You don't want chalk for bones. Chalk is not strong. You want something that really can give, that bends a little bit, that doesn't break. That's a strong bone. And to do that, you need all kinds of trace minerals. And those trace minerals and calcium is what's found in calapatite. Any other questions?
I think that's it. I think we're out of time.
Yeah.
Good.
So if you asked a question that we didn't get around to answering, do keep an eye on our Facebook, keep an eye on our blog. We're gonna try to tick off some of those. This is really nice for us because sometimes we don't know what you want to know. So this was a fun exercise, I think, to see some of the common themes, and hopefully we can address some of these things as larger seminars in the future. So do keep giving us your questions. We love to sort through those. Sometimes to us that stuff becomes old hat because we've studied it or we work with it a lot. So thank you all for coming. We really appreciate you guys attending and asking your questions, and I hope that you all have a good evening.
Next seminar, January, weight loss.
I'll just say thank you for the time you spent to do it too. And,
I appreciate that. It's thanks. It's to practice this kind of medicine, the doctor has to truly be in love with it. You have to truly feel it's a calling. We feel very strongly about that. And when we go to a symposium, for instance, which we do many of, we're going there, we're listening with our patients in mind and say, that's Edward. Oh, oop, Jim, I got to make a note of that. And it's you're constantly searching, and just the fact that the information is going to be doubling every 3 months is a little scary. So thank you.